This conference will now be recorded.
Kathleen, I'm hoping that we don't have anybody in Florida on a call.
Kevin is there.
Kevin is there?
Yeah,
Yeah,
he's there
I'm
now.
in Naples.
Oh my God. How are you doing?
I'm doing fine. It's been a little stressful. Um, we've got 50-mile-an-hour winds right now. The storm surge is coming in. It's up in the driveway. Not a lot of rain, though. All the rain's out in front of it. It's going to hit about 120 miles north of us. So we'll have probably 5 feet of storm surge, which will bring it up into not even the first floor.
And he's on the second floor.
Well, I hope you don't fall into harm's way, and thank you for joining us tonight. That's pretty extraordinary given your circumstances.
Live from the hurricane. Can you hear me?
You know, you'd be one of those people too.
Have you seen that clip with Jim Cottrell in it?
Yes.
Where he's doing his thing, where he's leaning into the wind, and there's a couple of guys that walk behind him like there's like nothing going on. He turns around and goes, live TV.
Right. Too funny. So good evening, everybody. My name is Kathleen. I'm one of the moderators. We also have Kevin, as you just heard, who's in Florida, is also a moderator. And we have Regina, who is also a moderator. James has been with us for a while. Wendy has too. She's under waiting for name. She can't figure out how to put it on, but that's her name is Wendy. We should be having one more person join from Long Island I just met. Her name is Carol, and she's a newbie for sarcoidosis. So I'd like to go around the room and just ask what type of sarcoidosis you have, and if you had to choose one thing to get rid of, what would it be? All right. So I'll start first. My name is and where you live. My name is Kathleen. I live on Long Island, New York. I've had sarcoidosis for more than 20 years. If I could get rid of one thing with sarcoidosis, it would be the bone pain, because every joint and bone hurts. Kevin, would you like to go?
Sure. My name's Kevin. I have sarcoidosis in my lymph nodes, in my lungs. I'm in stage 4, so I have fibrotic scarring, and I also have it in my heart. The heart is more recent, so I've known I've had it for about 14 years, and the last 4 years I've had the cardiac involvement. Every day is a gift, and I'm grateful for all I have left in terms of functionality and strength and energy. And I'm grateful to be alive. If I had one thing I would get rid of, it's the constant cloud of it might come back at any time. Real drag.
Totally understand that. Regina, would you like to go next?
All righty. I am Regina. I live in this ungodly state of Indiana, and there's nothing to do here. Literally. I am in my 30th year. This is my anniversary year. It started in June. I am a chronic patient of sarcoid. If I can get rid of one thing about, well, I'm going to say 2. Sorry. If I can get rid of 2 things of sarcoid, it is the constant fatigue that I have. And at this moment, the massive headaches that I have now am dealing with.
What's your type of sarcoidosis, Regina?
Excuse me?
Well, what is your type of sarcoidosis exactly?
I have lung, skin, and neural sarc.
Okay. All right. Thank you.
Thank you, Regina.
Yes.
Rebecca, would you like to come on now? And welcome.
Thank you. Can you hear me?
Yes.
Okay, so I just found out about this group from the Cardiac Sarcoidosis Facebook group. I first found out I had sarcoid in the fall of 2022 in my lungs, and some in my lymph nodes in the lungs. And then this past spring, I was having heart trouble. Turned out I had sarcoid in my heart. I had to have a pacemaker defibrillator inserted, and I started treatment. And the thing that's bothering me the most now is kind of this attack of arthritis. Like, I do sometimes feel like every joint hurts.
Yes.
So I guess if I wanted to get rid of any kind of I mean, I'd love to get rid of all of it. I want to have it in my spleen too, but it doesn't seem to, I don't feel anything. I guess I'd prefer not to have the arthritis.
I understand that.
It can be very,
so. We understand.
And I'm just here to learn more because it's all kind of a big shock.
No. And just as a sidebar, everybody, Kevin, myself, and Regina are not doctors, PAs, nurse practitioners. We're patients, just like you guys. We all learn from each other, if that makes any sense. So, James, would you like to go next?
Oh, sure. So I go back to 2019, and I say that for a reason because it's almost 6 years. And I've done some work with Regina, but I've known Kevin and Kathleen for a long time. And despite what she just said, I have learned more from this group than I have from any of my doctors. Now, granted, I have good doctors, except for one. But I wanted to bank off Kevin because I had something happen 2 weeks ago. I've had let me tell you, I have sarcoidosis in my heart and also my spleen and my ribs. And it was,
Bless you.
I had the regimen of, what's that horrible drug they give you at first?
Prednisone?
Prednisone, which, no, thank you. And I've been on methotrexate for almost 4 or 5 years. And I finally pestered my cardiologist. He doesn't want to give me a PET scan. He says it's too expensive and blah, blah, blah. So I finally got him to give me one. And I went to Mission Bay in San Francisco. I'm a Kaiser patient. And the next day I got my results and I was nervous about opening them, but the doctor called me. Now, this is a guy who would never call you. He's such a clinical guy. And he said, congratulations, you have no more sarcoidosis in any of your organs.
Nice.
And I couldn't believe it. It's like, and I just want to say, it's rare that happens. And I said, well, is it going to come back? And I'm banking off of Kevin because this has been the persistent worry I've had. Is it coming back? He said, oh no, it'll burn itself out. It's gone. And I can't believe this. And it's not, I feel guilty on this broadcast because everybody has had these long-term things, and you guys are such soldiers with what you do and how you've done it. But you've all been such an inspiration to me and hope. And so there is hope. And I have to tell you, I feel a whole lot better these days. I'm doing a lot more stuff that I used to do.
But how can they tell that from a PET scan?
So what a PET scan is they shoot a radioactive fluid in you, and you have to go on this sugar-free diet for 3 days, which is a killer in itself. And they take pictures of you, literally. And if you have any disease like that, this also for cancer, it glows. You actually get these little things. And previously I've had a CAT scan or PET scan, excuse me, and I've had the glows, and that's when it came back after prednisone. But this time there was nothing in the pictures. It was completely clean. And the radiologist said, this is a pretty amazing thing that there wasn't one speck of it anymore. So now I glow in the dark.
We all know that. Kevin apologizes, but they just lost power.
Oh,
So he lost the internet as well. So we'll catch him next month. Everybody gets just good vibes towards him if you don't mind. He's riding it out. So Rita, would you like to come on and tell us?
huh?
Rita?
Yes, I'm sorry. This is my first time coming, so I had to
Well,
download the
welcome.
app.
Welcome
Me
very much.
too.
All right, good catch. I can finally see what Carol looks like. I've been talking to her. Rita,
Nice
how
to
long?
meet you.
Nice to meet you as well. How long have you
Nice to
had?
meet you. Nice to meet everybody. So I'm laying down because I get fatigued at this time of day.
Understood.
So I just found out I have sarcoidosis. I think I'm maybe 4 or 5 months into my diagnosis. I think I got diagnosed in either April or May. But I have been going through like a year-long. So it's been exactly 1 year that they found some issues. So to make a long story short, the biggest part has not been by diagnosis, it's been the amount of grief because I was pulled from my fertility process. I found
Oh,
out through this because I was going to start my own family. In there was a whole lot of testing going into it because I would have been a geriatric mom, but they wanted to make sure my heart would be strong enough to carry a child. And that was the very last thing I was going to do before I got inseminated, which would have been last October. So it's been exactly 1 year. And at this point, I think my child would have been like 2 or 3 months old. But anyway, it's the grief. And when I went in to do they wanted to check my EKG. And when they checked my EKG, she was like, I think my machine is broken because these numbers don't make sense. You look perfectly healthy. So they redid the EKG and the numbers were still being very weird. And she said, She said, I think my machine is broken because it's looking like you either had a heart attack or having a heart attack or will have a heart attack. I said, I'm fine. I haven't had any like I'm great. What are you talking about? And that's when they told me to get a echo just to make sure since I would be a mom and it's hard on the heart. And when I went in for my echo, everything was fine. I felt fine. Or my stress test. I'm sorry. It was a stress test and an echo. The next morning, I went in to go to work. It was about 7:50 and my phone wouldn't stop ringing. And when I answered the phone and I heard that it was my cardiologist's voice, I knew something was up. And that's when they told me I needed to check into the hospital. And it was my birthday weekend too, so I didn't go anywhere. It was the worst. I just remember staring at the ceiling all weekend. And when I checked in to do my heart cath, they didn't find any. Thank God I was taking care of myself because all of my veins and stuff was clear. And so at that point, it was like a mad dash to figure out why my EVF was so low. It wasn't any blood being able to get out of my left ventricle. Going through all of the things like you all, massive amounts of rheumatologists, immunologists, all of the things, which fast forwarded me to my lymph nodes one of my lymph nodes was swollen. I didn't even notice that. Had to have surgery in March to get my lymph node diagnosed. They had to actually remove my lymph node. No sarcoid cells, which went into more procedures. And finally, I had to go on heart monitor. And then I went on IC. They ended up giving me a pacemaker ICD in August. And I didn't get an official sarcoid cell. But after looking at my PET, my whole chest cavity initially lit up. But when they went in and did a further look, my lungs were clear. And my heart, eventually they was able to see my heart wasn't. So I officially have a diagnosis of cardiac sarcoidosis. And I started treatment, I believe in May. So I started taking medications. Well, I started in last year taking just regular heart medications, but actual treatments for autoimmune started in between, it was either April, March, or May. One of those, because it's all a blur because I've had so many surgeries and procedures in the last 6 months. So it's nice to meet everybody.
It's very nice to meet you.
too.
Wendy, do you want to come on and say hello? And
Hi, everybody.
Um, I wonder sometimes if it's good news or bad news. Um, so I have drug-induced osteoporosis now from the treatments that I have from sarcoidosis, from the prednisone, I think mainly. I don't know if it was a Remicade, but I am in severe pain. Um, my life is just so sheltered now because I can't walk. I don't know what's better, having full sarcoidosis or what I'm going through now.
Mm,
Um, but I feel so alone because um, I was, so happy when they told me that my neuro was inactive, and then I had a window of like 3 or 4 months, and then things started to happen with my
mm,
bones,
mm,
all on my left side of my body.
mm,
And it's so bad that they can't operate, and my spine.
mm.
Um, I just don't, we were warned that if we took prednisone at high amounts, that it could do this to us. But I haven't met anybody yet that this has happened to. I feel
Okay.
alone, like I felt like when I had the neuro and I couldn't figure things out because I'm on painkillers that I can't figure things out on. Um, so, I mean, like, where's my journey?
Yeah. I'm very glad that you came on with us. I haven't seen you in a long time. And I think I still have your phone number if it starts with 806. So you should have, that's not you? Okay, we'll get on Facebook together. We'll try and let's set up a call for like Friday. It's just, one of the things that we all feel is that we're the only ones that have it and other people don't understand. And you know what? They don't. They're not going through the pain you are. They're not going through all the doctors that you are. We need to be support for each other. And Wendy, I will be in contact with you by Friday. Okay? No problem.
And
I'm
I know
not sure.
everybody's introducing their, I know everyone is introducing themselves, but do you mind telling me more about eventually more about the prednisone side effects? Because I wasn't giving anything. It was just like, take this medicine. So I would like
All
to
right.
hear more because that's scary to me.
Well, let me pull this up. So first thing is that prednisone gains weight. So
Mm-hmm.
that is definitely weight gain. You can have swelling, insomnia, mood changes. I definitely have that when I go on
Mm-hmm.
prednisone. So my husband may have not done anything wrong, but I asked him to do things like 2 or 3 times. So I'm watching the train leave the station to yell at him, and I can't stop it. So headaches, heartburn, that's a big one. Thin skin, possibility of blurred vision, gastritis, dizziness. I mean, it kind of goes on and on. If you're currently taking prednisone and you're stable, you just shouldn't be on it for long. If you can get off of it, because it hurts the bones. Osteoporosis is what it's said to give us when we're on prednisone high doses for a while. But again, you really need to work with your doctor or doctors. They are the leading. Miss Regina.
And may I add, you really do want to be careful with it because it can also make you look like you're diabetic
Yeah.
if you're taking very, very high doses.
Hmm.
I'm proof of that. So,
Yeah.
because I can no longer take steroids.
Yeah. It raises your sugars to a
Yes,
very high level. So that should
yes,
be able to be seen in your blood work.
yes.
I
Sorry, have you
Nope.
know I am not a diabetic. I spent 30 days in the hospital because of steroids. I can no longer take steroids. So,
So
yeah.
please remember that as well. I'm not sure how. Yes, Rebecca.
I was just wondering how is a high level of steroids defined?
50
For,
milligrams, 30
yeah, for me
milligrams.
it was 40. For me it was 40. So
60.
Yeah,
Okay.
so it really depends upon you. Make sure
yeah,
they will. Just I don't trust doctors very often, so I make sure I get copies of everything. Blood work, lab samples, doesn't make a difference. I
exactly.
want a copy of every single test, PET scan, CAT scan, X-ray, whatever it is. Make sure
Okay.
you have a box because you're going to, well, I chronological it, but, and
Yeah,
for
learn to read your scans.
You got to double
Understand
check it
your medical papers. Learn to read
because
them.
they don't.
What
Can I
Wendy
ask?
just what Wendy just said, I don't know if anybody heard you, but make sure you're double checking and verbalizing to the doctor, well, here's what it says on my piece of paper. What does that mean? Because sometimes they're like, oh, that doesn't really matter. Yes, it
Right.
matters to you. And you know what? You're paying them. So I'm sorry, Rebecca, go ahead.
No, that's fine. I was just curious to know because I'm currently on 20 milligrams, and so
And it's not
Yeah,
horrible.
I
No.
was I was on 20 milligrams and I just couldn't handle it. I didn't sleep for 5 days
Oh dear.
and I had to stop after I finished my dose, but I think that's what exacerbated my condition actually. It didn't actually make it better at all.
The prednisone
Yeah,
exacerbate.
at all.
Can I?
And then I stopped it after 2 weeks, like,
Mm-hmm.
cold turkey.
Ooh,
And then
bad.
like after like a month or so, like the inflammation got so bad, I asked to come back on, but on 10 milligrams. So you kind
Mm-hmm.
of gauge with time, like what's your dosage, what you can handle. Like me
Right.
was like 10 milligrams. I stayed on that
It's
for
good
3 months, 4 months.
you did that because I tried to do that and because of my neuro, they kept on telling me, no, you got to take this because,
Mm.
we're trying to knock it out of the inflammation out of your brain.
Mm.
How
And
long were
Do
you
you
on
have
it?
neuro?
No,
Carol,
How
maybe I
long were
do,
you
but I
on
don't
it,
know.
Wendy? How long was
when
Wendy on the prednisone?
But
Wendy,
Um,
just to complete something that Kathleen and others and Rebecca brought up, if you do get a high dosage, you need to also have a taper
hmm
because yeah, and they tell you not to cold turkey with it, but
Hmm.
it's important that you just don't start and they say, well, you can take 30 milligrams for
right.
the life. No, you can't.
hmm
You shouldn't. And by the way, I have one word for prednisone. It's a horrible drug. Sorry.
Yeah.
How
No,
how long
See, I
was Wendy
wondered.
on it
Oh, go
for?
ahead.
it depends. If they're really trying to hit you with neural sarc, they could have you on it for more than a month. I've known
I
some
was on it
people.
for 10 months.
mm,
Yeah.
I
So
was on it. I was on it almost three
years.
years and maybe 2 months. But what
Jeez.
happened was they did taper it down when I got on my Remicade.
hmm
Um, and thank God I knew about Remicade because Regina, that's how you know about things.
hmm
And then I went to a really good doctor in Albany, and he said, "Yeah, that's right."
Yeah.
So, so I want to tell you all that this group really helped me a lot too. And I want to tell you that I was told by my doctors not to be on this group because they said it would make me depressed. That everybody in this group probably, will never get better, and I'm going to get better, they told me.
Mm.
And I don't know if any of you have heard stuff like that from your doctors.
No,
I
I
can't
haven't.
believe
No,
how
I wouldn't
it
trust
must
that
be a
doctor.
Rochester thing then.
Mm. So, thank you, Wendy, for that. I'm not sure how to pronounce your name, dear sir. Is it Gambler?
Oh, I'm so sorry. I I set this up a while back. And my real name is Nassim, but like when
Oh,
I had like a conversation with another subject in another lifetime, and this application popped up, and that name that I had taken back then came up, some kind of gamer
hmm
name. But
Next
anyways,
time, keep it like that. It's a cool name.
yeah.
Gambler, thank you. So
So you have the floor, dear sir.
yes, my name is Nassim, and Well, first of all, I just want to say thank you for sharing all your stories, and especially Wendy's. And don't like, forget about these doctors. They're you know they're none of them understand what we go through. These people are procedural. They're a bunch of machines, and they just look at attacking the symptom, and they don't even care in the hell in the world where your sarcoidosis came from, the root cause. They don't want to look for it. So you are your own physician. You have to take
Mm-hmm.
care of yourself as much as you can. And I doubt every single thing that they tell me.
Mm.
And anyways, I just wanted to say this out there. And so so okay, I'm probably the only Canadian in the room here. So I'm from Montreal, Canada, from Quebec,
Mm-hmm.
and I caught
I used to
sarcoidosis
live in
around.
Quebec. I used to live in Quebec
Oh
on the
yeah,
Queen River
with
until I
what
was five.
Trois-Rivières?
Parlez-vous français?
Yes, yes, on parle de
I
français.
haven't spoken French in years. I live in Rochester, New York. I don't live far from you.
Oh, okay, well, nice to meet you, neighbor.
Yeah.
Well, so that's it. So I'm from Montreal, and I caught sarcoidosis 10 years ago after a renovation that I did like unprotected. I breathed in a
Mm-hmm.
bunch of crap,
Uh,
and well, it stayed in my throat for a while, then moved to my lymph node, then it moved to and then recently into like my lungs, and to my as well as my throat as well, and my nose, and it's
Mm-hmm.
like it's all over the place now, and it's causing me a lot of trouble. And really, like, if there's one thing I could remove from it, I think I could tolerate the pain, but the breathing issues, I want to get rid of them. Like, this
Mm.
is the one thing. I don't know if all of you have breathing issues yourselves, but
If we all
mine is
have it
like,
in our lungs, yeah, unfortunately.
you have
So,
it daily. I have it daily. It's like a routine, and it's like it starts in the morning and calms down maybe around like 7 p.m.
mm-hmm. Yep.
Especially during work time, because it's very positional. It's weird.
Mm-hmm. Yeah.
So okay, well, anyways, I just wanted to ask you guys if you all had it as well. So
Yes.
so
Well,
what do
stay
they
with
give
us.
you for that? You see my hand.
Prednisone, right? You were on prednisone, is what you said, and you went off of it cold turkey. Am I
yes,
correct?
yes, and now I'm on methotrexate.
Oh, good, because that works for a lot of people, just like James had said to us. So I'll keep my fingers crossed. Hopefully next month you'll be feeling better.
Yeah, well, I've
Right?
been on it
Kathleen,
for a few months. It's not really like I just want to. Regina has a very similar condition as mine in terms of like the breathing.
Mm-hmm.
So like, and I think she went on to Remicade, and that one's looks really interesting. But going into biologicals is really difficult to like bring your case towards like the doctors.
Mm-hmm.
They make it difficult for you to get on there if I guess if you're not like
yeah.
systematically dying or something like that. I don't know what.
Mm.
What
No, I
about
understand.
Humira?
That's I just started that in May.
All right.
Humira?
Yeah. Well, he's got to work with his doctors, unfortunately, too. But Humira is another one.
Remicade
So,
was the second choice.
yeah.
Infleximab is also one that I'm interested in.
Yeah. I'm on that
That's the,
now. There's
Oh,
that's the
another
same
one
thing
called.
with Remicade.
Does
Yeah,
anybody, do they still have like grants for infliximab?
I don't know, to be
I
100%
don't
honest with
either. I haven't been on it now for 2 years, so I don't know.
you. Yeah, I don't know. Sorry. But I could talk to your
James, what
friend
do you
about
attribute?
that. What's up?
James, what do you attribute to your remission or your or not cure, but what would you say was your reason? Do you think it was like natural diet and exercise, or was it a combination of therapeutic drugs, and I think
James,
you muted.
you're on mute. I know. I forget to.
Thank you. I have to say, in all honesty, that luck more than anything else. I mean, I feel lucky as all get out. Having said that, I think one of my strategies is I've been a very athletic, very active, just like Kevin my whole life. And I just didn't want to give up. I didn't want to give in to something that was my lifestyle and my friends, and it kept me going. And methotrexate, I didn't know what it was going to do, but I didn't have any uh, side effects from it, and it seemed to do the trick. So, and it's worked for other cancer patients. Now,
Mhm.
I, I've I don't want to get into this, but the whole drug industry and with the medical profession, I just shake my head because they try to give you every kind of drug there is for any kind of symptom, as somebody said.
Mhm.
But be that as it may, the last thing I would say to answer your question is that I really depended on this group and others to make informed decisions. It wasn't just, yes, doctor, I'll do this. Um, and like I said, I think I beat this because I followed my own heart and what I thought was right. So
That's a great answer, James.
thank you. I'll
Thank
go
you.
back on mute.
I want to try and make it through everybody else before we just like open it up. And I've got a couple of trivia things too. So Lisa, would you come to go next?
Sure. Hi, I'm Lisa. I'm from Long Island, New York. Uh, I have cardiac
Yay.
sarcoidosis that was diagnosed in February of this year. And I would say the worst part of the diagnosis is the medications. The prednisone was awful. I'm finally off of it. Now I'm on the methotrexate, which doesn't seem to be bad, except for maybe the day I take it. It's a little annoying, but otherwise it seems fine. Um, but that's a big change, is taking lots of medications.
Mm. And Lisa, where on Long Island are you?
In Port Washington.
All right, I'm in Suffolk County, like Ronkonkoma, and I
Okay.
think Carol's in Farmingville, right?
Farmingville, yes.
Yeah, I
Okay.
remembered that. So, um, Regina, what's up? Oh, after everybody. Sorry. Thank you for sharing, Lisa. I'm reading the chats and things like that. Rochelle, are you there?
Hello. Yes, I'm
Hi.
here.
Hi.
Hi, everybody. I'm not on camera because I'm in the hospital.
Oh,
Just
Sorry.
had a cath done earlier, and then they decided to keep me, and now I'm in ICU. So I look a
Oh,
hot mess. I don't want to expose y'all to that. But
oh.
I have cardiac sarcoidosis. I got diagnosed in the summer of 22. I have an ICD. um, and just been having a lot of issues with the heart, and my heart failure numbers, steadily going down. So they're trying to figure out, a lot of stuff.
yeah.
So I echo a
Mhm.
lot of what you guys are saying. The main thing is for me would be the medicines that can go away. I tried to get off, or I tried to get on a lower dose of prednisone, and it caused me to get hypotensive, and I was freezing, and it was a very bad situation. So I'm stuck at 5 milligrams. They'll say they'll wait a few more months. Probably now with everything going on, probably wait another year to try to taper down again. But I try to stay positive through everything. Um, Pain is, that's another common thing. Sometimes I have pain that just lasts for months and then it'll just all of a sudden just go away.
Mhm.
So just learning and hearing other people's stories and trying to stay uplifted and, knowing that we're not going to let this take over us. We're just going to still all be warriors.
Yes. Thank you very much for joining us.
Yeah. Oh, and from Chicago area.
Oh, the Windy City,
Yes.
right?
Yes.
So someone told me, tell me if they pulled the wool over my head. Somebody told me, a trivia thing, do you know why it's called the Windy City? And I said, because it's windy? And she said, no, because the politicians kept yapping and yapping and yapping.
Very
Is
true.
that true?
It's
Mm.
very true. It's not that. It's no windier here than anywhere else.
I had no idea, but
Very
thank
true.
you for joining us.
No problem.
Gail, are you available? Hi. Are you okay? Gail? She seems to have frozen. We'll come back to her. Carol, hi. It's nice to see you in person.
Hi, nice to see you too.
So,
Well, I live in Farmingville, Long Island, and originally I had lung cancer. I had back in 2009, and I've been getting CAT scans ever since. That's when they picked up the sarcoid on the, I had my lung cancer on the right side. They found it on the left. And I had a lung biopsy. I believe it was back in, I think it was 2021. It's kind of a blur. And I also had I have granulomas in my lymph nodes. They did a mediastinoscopy. And
mhm.
I also was on prednisone, like I said, for about 10 months. I briefly tried methotrexate, had side effects, briefly tried Arava. Then I've also been on hydroxychloroquine for a couple of years. And then I had to cut that down because my white blood count got too low. And then I recently, like I said, in May, started Humira. I have sarcoidosis, so it's in my lungs, my lymph nodes, my eyes. Now it's attacking my joints. I don't have it in my heart, but it affects my heart. I get tachycardia, I get dizzy spells, but and bad fatigue, like everyone was mentioning. But the joint pain is fairly new, and I'm having a hard time dealing with that. So I would like to get rid of that.
Me too. I
Yeah.
understand that. Regina, do you have something to share with us? And thank you for joining us, Carol.
Thank you for having me. I appreciate. Thank you for letting me know about the group.
Anytime.
So did everybody speak?
Yes, ma'am, except for Gail. Unless Gail, are you able to speak or no? And I think
Okay.
Rebecca wants, where is Rebecca? There you are. You wanted to say something? You have to unmute yourself, Rebecca.
Okay. So I heard a few people say that you have like pain or joint pain, and I guess I'm wondering, for me, this only started like a month ago.
Mm-hmm.
Mine just started.
What causes the joint pain? Is it, it's like not this, I have some osteoarthritis, so I know what that's caused by, but like, is it the joints themselves that are at issue, or is it, it's like, it really puzzles me. I've looked this up and I haven't understood it.
Regina, any thoughts?
I have osteopenia
Mm-hmm.
and osteoarthritis. And I know back in the day I had been doing some reading, and sometimes they say that kind of goes hand in hand with sarcoid, but also the steroids itself can damage your joints.
Hmm.
Hmm.
Yep.
Hmm. Okay, thanks.
It's
I
the
think
eyes
so
for me,
too.
and I know it has to be the prednisone. It's the eyes for me. It was so quick and so soon. I had to go to like a specialist ophthalmologist because of like, I don't know if you guys feel disconnect where it's not that you can't see, it's that I have to focus on what I'm seeing. It's like a weird, for me it's a therapeutic parts. Like, okay, like hindsight is 2020. I didn't necessarily know that I was experiencing symptoms until I went through this, and now like the medications, all of the heart palpitations I was having before are so much better. But at the same time, I feel like I've taken on actually being sick now since I've been on a therapeutic, and I don't know if it's because it brings the disease on. Now I don't know. I just know that all of the disconnects, like having to think a lot more, and I've stopped like any type of anything at night. I don't do because I'm not focused. It takes too much concentration to do multitasking. I can no longer really do effectively because of the amount of focus requires, like grocery stores and stuff. I have to do it like the top of my day before I start taking any medications. So like I go at 6 in the morning to like the grocery store because the amount of focus, because like I have to concentrate on what I'm seeing. I have to concentrate on what I'm saying. And like I just found out about the mood things. I'm not necessarily raging, but I notice I let anything come up out my mouth. So if my coworkers are getting on, my nerves, I'm like, you get on my
Mm-hmm.
nerves. And I was like, why do I? why? And I find myself advocating for myself a lot at work about things I normally wouldn't even care about. So I was like, so it's not that I'm raged out. It's more or less that I'm like snapping, and it could be that I don't know what to say, y'all. I'm trying to digest all of it. So I guess I'm asking about y'all's, because it's also affecting my relationships, and I'm relatively young. And I find myself like, should I just go ahead and be single and not worry about family planning? Because also we're on black label, or I'm on black label medications. Anyway, I don't know what the long term effect. Like, I just feel like I'm in this life transition, and I, honest to goodness, do not know which way to turn. Because I think I'm still trying to live like a normal life, but I don't think I need, because that's what they tell you to do. But what I think they should be telling us are telling me that that's gone. Like, I think like that, my dream, I think I need to become more aware, like who I was is gone. So I guess I
You are.
want to hear about your experience.
Yes. Regina, go ahead.
Okay. So that's true. And I do agree with that. But also with the steroids can further. This is what my the physical therapist said when I went in to get steroid shots in my knees because I had been getting steroid shots in my knees. So here recently, I decided to do a biofreeze and just buy it right off out of the store off the shelf and found out that the biofreeze has been helping. But this is what I really wanted to talk about. So 2 years ago, and Kathleen, I think I told you and Kevin about this, about the car accident that I got into.
Yes.
Um, I wind up getting acute whiplash. And
Mm.
that same year, earlier in that same year, I had also found out I had got neural sarc. And the car accident was not my fault. So as a result of that, I wind up having headaches. And also in that same year I had also found out that the doctor said I had clear lungs, supposedly, but I never had an X-ray. So, but I had one of my sarcoid checkups. I had a heart checkup, and my heart was doing fine. But I also got in a car accident that year. Fast forward, I wind up having a lot of physical therapy in reference to that car accident. Each year I had physical therapy because I constantly had a headache. Here it is, 2024, and I still had a headache. So in April, I went to my new pulmonologist here in my hometown. And as I was telling last month to the group last month, in my hometown, there's no neurologist that knows anything about sarcoidosis. And so my pulmonologist, we did not know that at that time. We was looking for me a neurologist. And then I was having headaches. And so he put in for a call to the neurologist for me to get a doctor because I need a neurologist for my neural sarc. No one ever called, so I waited about a month. So that next month, I had a regular doctor's appointment. I said, well, no one ever called. So she put in for other, and I kept telling her about my headaches. So she put in for other headaches. Well, it took them about a month to call me to get an appointment. I finally got an appointment this October. End of September, I got an appointment to see a neurologist. All this time, mind you, I've been taking 3 times a day, 1,500 milligrams of Tylenol to keep my headache down. I'm serious. I've never told anybody this, but this is how much Tylenol I was taking. 1,500 milligrams a day. And that's how I've been living all this time. So when I get to the neurologist, I'm telling him, he said, well, why hadn't you come in before? I said, why haven't you guys contacted me back in April? I needed a neurologist back in April when my pulmonologist sent the call out. Oh, well, we don't treat neurosarc. I said, well, you're going to treat me now because I've been having a headache since April, period.
Mhm.
So let me tell you what they did for me. They assessed me, but he said, but we don't treat sarcoidosis patients. Well, I'm still without a neurologist, but they did give me for my headaches a muscle relaxer. It's what I got. I've been taking that muscle relaxer every since for 2 weeks now, and I no longer have a headache.
Hmm.
Literally, no headache. And I'm like, thank the good Lord, because I have been having a headache for almost 3 years straight
Hmm.
with no relief, none whatsoever. Nobody could not figure out what was going on with me because they kept saying, oh, it's your blood pressure. No, my blood pressure has been normal.
Yeah.
I got a muscle relaxer now that I take now to relieve my headache. So today I was sitting here talking with my mom and thinking, is my neurosarc literally causing me to have headaches? And did that accident trigger something in my neurological system to cause me to start having headaches? And now because of all that, am I going to be on a muscle relaxer the rest of my life because of all
Regina,
that? No, I'm like, what in the world is going on now? You know what I'm saying?
Mm-hmm. Yep.
I do. Can
Yeah.
you guys
Huh?
hear me?
Yes.
Yes,
Can you hear me? All
Yes.
right.
yes.
I had the exact same thing. I was in
Hmm.
a motor vehicle accident. I was a healthy 54-year-old on no medication. None. I had my motor vehicle accident, and 3 days later, I'm in the ED emergency department in AFib,
Hmm.
and that's how they found my cardiac sarcoidosis.
Right.
And I'm convinced. Like I wrote a whole case paper on this, and I'm in a lawsuit with Uber right now because I was driving for Uber and I was injured, and it was permanent. Like I'm on disability. So yes, I 100% agree with that. In
Yep.
fact, it's most probable, and you and I aren't the only ones.
No.
There's a guy who was out in one of John Carlin's podcasts, The Sark
Mm-hmm.
Warrior, where he was an athlete. He was riding a mountain bike. He was doing CrossFit. Ooh, lights are back on. And 3 days later, he's in the emergency room, like back to the emergency room, and he's got sarcoidosis all over.
Yeah.
So yes, I would totally believe that accident
Oh
because you're
my
having
God.
the headache.
I was in a
That's a
horrible
concussive
accident
force. You were
too.
probably concussed,
Yeah.
and then you get the inflammation, and it sets up.
I was
Correct.
in a horrible accident too.
That's 3 people on the call that, so nobody get in a car accident. We don't want to get any worse.
I
I
wanted
was on
to
the bus. It was caught on
Hmm.
piggyback
fire.
off of James real quick. Just I wanted to say something that James said earlier about him, um, how he's no longer has sarcoid. About what I was going, the other thing I wanted to say is that when my doctor had said that my lungs was clear, I kind of didn't believe him.
Mm-hmm.
But I had an x-ray last month for my pulmonologist, and my pulmonologist actually told me I had no sarcoid remnants in my lungs. And
Huh.
I was like, thank the good Lord, because I'm not having breathing issues anymore, but I have issues elsewhere in my body.
Mm.
I know I have sarcoid elsewhere in my body, but I no longer have sarcoid in my lungs. And let me tell you, I was diagnosed in 1994. I've had sarcoid in my lungs all the way up until they told me I didn't have it anymore in my lungs. So
I'll
I
have what
know.
she's having.
Regina,
Yeah,
did
me
you
Huh?
get
too.
the Remicade?
So since
Regina,
1994, you've had like breathing issues,
Yeah.
Yes.
like on a daily basis,
Mm-hmm.
Yeah, always.
Right
Yes.
back.
and then it went away.
And it's no longer in my lungs, but I still have sarcoid, don't get me wrong. But it's not in my lungs anymore. But I have it
Regina,
elsewhere.
It's
Yes.
not.
Regina, can you explain to him that you were on medicines for sarcoid though?
Yeah, I've been on medicine all my life. Yeah. I'm still on Remicade. I'll probably never get off of it because
Yeah,
I have sarcoid in other parts of my body. But it
Regina,
right at the moment it's not in my lungs.
Regina, thank you for bringing that up. I I also wanted to speak to Gambler for a minute because uh, I I don't have sarcoidosis, but I still have lung issues, and I don't have sarcoidosis in my lungs. I got something called bronchiectasis, which I have a really good pulmonologist. She took a CAT scan and she actually walked me through and showed me where these little tubes where the oxygen gets into your body, they enlarge and they produce uh, phlegm and things like that, because that's what I was
Yes.
getting every day.
Yep. Yep.
Yes.
And, it was like, hallelujah, I finally know what I'm dealing with. She gave me a nebulizer, which is this little air pump that
Mm-hmm.
puts mist in your lungs. And it doesn't cure it, but it makes it tolerable. So I just wanted to tell you that I don't have sarcoidosis, but I still have lung issues. And
Yeah.
also, I did have AFib
Mm-hmm.
because of sarcoidosis, but I don't have AFib anymore. So
Right.
it seems to be all over the
It's true.
map.
Mm-hmm. So
But thank you.
I'm sorry. My pulmonologist in Cleveland Clinic, the time when I saw Regina, told me to buy one of these and exercise my lungs.
Ah,
It's $5 off of Amazon. So you breathe into this and the
Right,
little thing goes up and down.
right.
So we exercise our arms, we exercise our legs, our brains, what little I have left. So and before we end, because I am being conscious of time for everybody, I mean, if you would like to stay longer, we can. But I would like everybody who's new to put your email in the chat. The reason being is ANCAN gives us this platform to do it. They will send you a message about the next meeting.
okay.
So they'll say, hey, the next meeting, which it is November 13th. So, and while you're doing that, if you don't mind, I'm going to do, uh, so I'm speaking with the FDA on October 28th with the FSR, which is very
Oh,
exciting for me.
is that the thing where we do the all day thing?
Yep, yep,
Oh,
yep.
I'll be with you, hon.
Excellent. So, Regina, I looked up the history of sarcoidosis. Okay, so it was founded in 1877 by a
I did a paper
dermatologist.
on it
Uh-huh.
years ago.
1889, 1889, it had bone involvement. 1902, they found another type of bone involvement. 1909, they found sarcoidosis in the eyes. 1914, synthesized the many syndromes of sarcoidosis. In 41, they biopsied the skin to find sarcoidosis. So that was the first biopsy of the skin. 1954, they established sarcoidosis as an immunological disorder. In 58, the International Conference in London, the first one. 1961 was the first conference in the US in Washington, D.C. That's all it has, ladies and gentlemen. So from 1961 to this day, I know there's been breakthroughs, but it's not up there. Interesting.
Sad, isn't it?
Yeah. I'm going
I
to dig
have
a
a
little further. Go ahead.
I have a question for the group. Is anybody taking a steroid inhaler? And does the steroid inhaler also cause problems like the
Not,
prednisone?
not as much as the prednisone. I have
Okay.
Brio that I do
I
every
have
morning.
Annuity
Mm-hmm.
that I
So
do, Ellipta that I do at night.
yeah, it's
I also
simple. Rebecca?
I have asthma, so I've been using a steroid inhaler for like 30 years, and it doesn't
Okay.
seem to have the same systemic effects as
Okay. Well,
prednisone does
that's good to
Correct.
He
know.
never did anything for me.
Mm.
for your
I
lungs. Yeah.
I got Symbicort. You know Symbicort, and it
Mm-hmm.
doesn't do much.
Be careful with your teeth. You
Yeah.
have to brush your teeth right after you
Yes.
take a
My
puff,
they
or
Yep.
your
the
Okay.
teeth will rot out of your head. My
my
Yeah.
dad
pulmonologist said keep it
was
by
awful.
the sink when as soon as you rinse your mouth out and brush your teeth immediately.
Yes.
Yep.
I
Right.
was
So
gonna
it's
say
not
that
just
too,
the
the
teeth,
teeth
it's
Well,
thing. Yeah, the
you
teeth.
said your dad it ruined his teeth.
Yep.
and also
Yeah.
it can
But
you can get thrush in the throat. You
it
can get a fungal infection.
Correct.
he couldn't get any more implants. The bone grafts wouldn't take in his jaw,
Mm.
Oh, well.
Oh,
and all of his implants were falling out.
oh God.
It was awful.
And there is something called oral sarcoidosis, guys. So if your gums start
Oh
feeling red
Lord.
and you got these things that go up that it's difficult to floss, I do have it, unfortunately. So that is oral sarcoidosis. I hope
Yep,
nobody
I
else
had
gets
it
it.
before. That was the reason why I got sent to the hospital because I had it so bad. I mean, it
Hmm.
just came out of nowhere, and then I got that 40 milligrams of prednisone, and then got sent to the hospital because it looked like I had DKA.
Mm-hmm.
Yeah.
Yeah. So there is
But
something
then this
called
is
that.
my question: are you all getting in a sarcoid cell diagnosis? Because they never have been able to pull a sarcoid cell. They just deduced it down to me having everything that aligned with cardiac sarcoidosis, like the scar tissue, this, that, and the third. But I haven't ever had a sarcoid cell pulled.
Yeah,
Oh, they
I've had.
did a lymph node removal for me.
Me as
Mhm.
well.
I got it from
They
What?
did me as
I
well.
didn't understand what you were saying, Rita.
She's saying
Say it
that
again.
she didn't have a biopsy in yet.
Oh,
So
No,
I
I
I
did
Biopsy?
have
have.
multiple.
No,
I've had
her
specimens
biopsy is
pulled from
not
my
going to tell.
body. Right. I had biopsies pulled because my lymph nodes had swollen and they pulled them out. I just had surgery on those, but it came back without a sarcoid.
yeah.
Like it was, I guess, negative or inconclusive, whatever. There was no sarcoidosis indicated,
Oh, mine
but
came
that
back
was
with
not.
sarcoid all over it.
Me too.
That's what I'm asking. Like, has anybody else received a diagnosis, but not necessarily had a biopsy? Because the reason why I don't have they gave me a cardiac sarcoidosis diagnosis because I align with everything except for having had a sarcoid a positive. The
Ah,
reason why I declined them going into my heart with the needle because nothing would have
okay.
changed. Like nothing
Right.
would change if they go in.
So,
I'm still gonna be on the same exact medication. Like that's why I opted out
mhm.
because
Oh,
the lymph nodes was so invasive. I didn't want them to go in my
yes.
heart, and it causes me to go into A. In my mind,
So
if
Rita,
my EBF was low, it was go. I didn't want to be pushed into A via them going in to get a cell. Does that make sense?
It
Rita,
Yep.
does.
maybe it was the okay, like your heart. Maybe it showed up on your heart, like you had some kind of scarring out
Hmm.
on the outside of your heart, because that's what happened with me. They told me that I thank God that I got on the Remicade, because they definitely think I had heart sarcoidosis when I did. So
Hmm.
maybe
No,
new images came up. Did you look at those?
no, you're right. That my pet, everything lined up with a sarcoid patient. So that's why they put me at cardiac sarcoid. And I've been moving forward with the doctor team. I guess what I'm asking, would you accept a cardiac sarcoid diagnosis if there's not been a biopsy to test positive?
Yeah,
And
they
in
do
order
it
to
all the
test
time.
positive,
Have you had
Yeah.
Yeah.
a Have you had a PET scan
yes.
and
I'm,
you have inflammation in your heart?
Yes, I had scar tissue and things in my
All
heart.
right.
Yeah, that's how
That's
you
enough for
tell.
That's
diagnosis.
yeah.
enough. You don't need to have anything else
And
done.
you really don't want to go. You're correct. You don't want them going into your heart because you could have sarcoidosis on your PET scan, and there's still no guarantee they're going to find that tissue, and it doesn't matter. It's there.
Hmm.
Yeah, they said they were going to go in with the needle because they did the needle on my lymph nodes, and when they did that, it swelled up the whole side of my face. And in my brain, if I'm already fighting a low EVF and they go in and it swells up on me, it could push me in. You see what I'm saying? Like it'd be different if I was at full capacity heart, but when you're
Yeah,
looking at
yeah.
my numbers,
You don't why would you have to do it in your brain? You don't have to with neuro.
No.
no,
They
I don't have brain. I said in my heart, like I just didn't want to do the needle thing, and it causes my situation to become worse. That was what I was thinking. Am I making sense, y'all?
Yeah.
It
Yeah.
is.
you you know
I was
what,
not.
Rita? I would definitely speak to a Sark um uh heart doctor. They are so intelligent with sarcoidosis more than uh, pulmonary and heart are like right on. I don't know why there's not a lot of neuro doctors, but there's a lot of the heart ones. And if they're
Lisa,
telling you that, you definitely probably have it.
Were you saying something?
Yeah, I have the exact same situation as you. I'm not sure who's speaking, but the woman in the ICU or CCU. I have the same thing. I had the cardiac sarcoidosis. I had the PET scan. They say it's suggestive of cardiac sarcoidosis, but there is no definite diagnosis. And they did not want to go in with the biopsy because even if you get cells, sometimes they're negative, but they just didn't get the area that is. So it's not even definitive if it's negative. So, and it doesn't change your care plan. You
Mm-hmm.
still have an inflammatory process and you need to be suppressed, is how it was described to me. So I'm just moving forward, and maybe someday I'll know definitely yes or no. I also had the genetic testing done, and I'm waiting for the results. I think the end of October I'm going to be speaking with the geneticist on that.
Great.
So
We
What
look forward to
what are
hearing
they
it.
looking for
What
there?
does the genetic testing do? I'm sorry, I want to hear this. What does the
I
genetic
never
testing do?
heard about that.
yeah, they look at a lot of she ran like 200 different tests to see if you have a genetic disposition for uh, anything. She said, "Do you want to know the results?" There's nothing specific to tell you, is I guess what I'm saying, but they check for every single thing that you could have genetically that they have tests for at this point. They ask, you have to sign all kinds of waivers that you want the results. Do you want to know that you're susceptible to MS or some other anything? So
Mm-hmm.
uh, I know one of my tests, I get the results on the computer. Most of them have so far come back negative, but one of the cardiac ones came back with some markers. And when the geneticist ran the test, she said, don't even look at it when they come back positive. She said, wait for me to talk to you about it because you'll be going crazy for 2 months and I'll tell you it's nothing. So
Mm.
I think it is curious though that I have the cardiac, so we'll see what they say when I speak with her in
So
October.
are you going through fertility? Because they did give me genetic testing during fertility, but that was to see if I would have a child with certain aspects, and I didn't test positive for this, which was crazy. It was something else. Are you
Right.
going through fertility, or is it specifically for
No.
your body?
No, just specifically for actually it's for I have children, my 28 and 25-year-old. So it's more for them to know if they're going to be inheriting this, if there's something we should be looking for. I had third degree heart block and had to have a pacemaker put in and the defibrillator. And so third degree heart block with the VTAC, and I was very lucky that I made it to the ER and was externally paced and survived. So they just want to know for my children that what should they be looking for, what should they be following up for. So you're right, it is for genetics, as in if you're going through fertility, but in this case it's for already born children that are older.
I think I'll look into that too, and
Good
I
to
can't
know.
wait to hear about it. Our next meeting
Yeah.
is November 13th, so we'll all be on the edge of our chairs waiting to hear.
Yeah, interesting, right?
Yes, very. And I don't want to keep anybody. Does anybody have any last questions or yes,
I
sir,
actually have
Becky?
question, but it's really for Wendy, because you said that you live in Rochester, and I live in Ithaca, and so I've been going to Rochester for, to see doctors. And I was just wondering,
Okay, so
are
who
you,
have you been seeing in Rochester?
I saw Dr. Gajar, I saw Dr. Palma, rheumatologist.
Oh, that's my doctor.
Ah, okay.
Hmm.
I'm going to see him at the end of the month. That's where I went, and I got my ICD put in April.
Dr.
Like,
Palma's Dr. Palma's really good.
yeah,
You're
he seems
glad
really
you're
good to
going
me.
to him. He's very the Star Clinic there is very good, but if you end up in the hospital and you don't tell them you're with the Star Clinic, they will treat you like dirt. I made that mistake. I was so much in pain. I've been in and out of hospital lately because I've been having a lot of problems with my condition now. And I went in through the neurology team, and they were all on top of everything to tell me that it's not, it's from the medicines, it's not from my what's happening with me now. So Dr. Palma is really awesome. Do you have any other doctor that you want to tell me about?
Well,
'Cause I,
the cardiologist I'm seeing is through advanced heart failure, although I actually don't have
okay, so
advanced
it
heart
says Dr.
failure.
Sabu.
It's Dr. Gajar, Gaggar. I think she
Okay,
must be one of the.
they're all in the same group.
Yeah,
They're
they're all in the same group. Yeah.
Yeah, in fact, the one doctor, she was on a FSR thing that they had, and they did the first heart transplant at the U of R for a star patient.
Really? Wow.
Yeah, she didn't survive. She was from Rochester. She
Oh,
lived.
that's
She was a mother, and she lived for, I would say, about 2.5 years after her transplant. But yeah, the heart program, they're very, they're awesome. But like
yeah.
I said, if you end up in the hospital again, let that team know you're in the hospital, or you're going to be screwed because nobody knows about sarcoidosis.
Yeah.
Well, all I can say is when I was in the hospital, I felt like I had like three different cardiology teams visiting me every day.
Mm,
It's like,
crazy.
well, this is interesting.
Were
It
you
is.
were you on the cardiac floor?
No, I never made it. I basically never made it out of the ER. They didn't have any room for me in the cardiac floor.
Hmm,
I had to
Wow.
drag.
that's crazy.
It was an
Is that
interesting It was an
that's a
No,
interesting anthropological experience, let's put it that way. The
I'm
hospitals
so
were
glad you're positive about it, because I was stuck in that I was stuck in that hallway for 3 days,
oh
and I
god.
couldn't move, and I have to wear a diaper because of my neurosarcoidosis, and I got really screwed up, and they didn't change me for 3 days. I couldn't move.
Oh
hmm.
god.
I can
And
Lord.
I can
ladies,
so just I would love to
ladies,
get in contact with you, and I'd love you to come visit me.
all right.
Yeah. Let's
So
do
let's work
Um,
that.
on that for next week, next month. Carol, you just had a question. Is it kind of quick
Oh,
or?
yeah, I was just asking for the people that have the neurosarcoidosis. How did you start? Because all of a sudden I've been recently getting now dizzy spells like every day, and I don't know, is it from medication or is this just a new symptom that I've been having?
Regina?
well, it could be any heart. It could be heart, neuro.
And the heart too. They told me I don't have it in my heart, but I'm getting the tachycardia. They told me I have a right bundle branch blocked, and they told me I have something with the calcium and low cal. I can't even speak. I This is what happens too. I say the later it gets, the stupider I get. I can't focus.
Well, mine started when my doctor, because I was having gut issues, and my doctor asked me, "Did you have a brain scan?" And I'm like, "Huh?" Because your brain sends messages to your body. And I never thought about that. And then I said no. But what happened is my body just started going out of whack. And I had a lot of GERD, and they could never, the GERD medication, none of that stuff would work. It never helped. Nothing helped. And so when I was telling you about the steroids,
Hmm.
that didn't work in 2019. When I got out of the hospital, I wind up having to do
Honey,
injection. So the what do
do
you
you
call
like
this
the
sugar
honey?
injection? What do you call that stuff? I don't know. Anyway, I never had to do that before, but I kept getting sick and sick and a whole bunch of stuff was happening to me. But in between all that time, my skin doctor is a my dermatologist was working with me because I didn't have anybody who can give me what I needed. I needed to get another treatment protocol because the treatment protocol that I was on was not working. So I had a Cleveland clinic at that time. I was in Cleveland getting my all my doctors were in Cleveland. Um, at that time, I had an appointment to see my pulmonologist, and so I was talking to him. So he ordered me Remicade, but I couldn't get my Remicade across state lines because
Oh.
I live in Indiana.
Mm-hmm.
So when
Hmm.
I got back home, I had a dermy appointment. So when I talked to my dermy, he said, "Do you have anybody do you have a right hand person?" I said, "No." He said, "Well, I'll be your right hand man." So he called my pulmonologist in Cleveland and they got together and talked. And my Cleveland doctor gave him my prescription. So they got it all worked out. And as soon as like this time in October, it was in an October month this time in 2019, I got my first Remicade um, um, I
Infusion.
think infusion. I think then I had neuro, but didn't know it.
Mm.
But I got my first infusion, and when I had that appointment back like a year prior to that, it was with a gastroenterologist, and he was the one that asked me had I ever had that brain scan. So fast forward to 2019 in October, when I got that first infusion with Remicade. Let me tell you what, that within a week's time, it was like joy juice, and that's what I call it, my joy. I have never felt so much better in my entire single life. Fast forward to 2021, the first part, I started finding other things were happening to me. Like I was having like some memory loss. Something else was going on. So I decided, okay, I'm getting ready to go get this brain scan because that notion never left my mind. So I went to go because I was also listening to some people on Facebook. They were talking about I had all this swishy noise going on in my ears, some like I was something was going on with my ears and I couldn't figure out what in the world it was. So I decided to go to an ear, nose, and throat doctor. And so I went and I knew I would probably need a brain scan then because that's where they said go was to an ear, nose, and throat doctor. So I made an appointment, but I came with my axes with me. I had some throat axes ready to go. So when I had to have a hearing test, because I had all that noise going on. So when I got into the doctor's office, I saw the audiologist first. I got into the doctor's office and he said, "Well, you losing your hearing. You need hearing aids." I'm like, hold up. No. I want to know. He said, "Because you have some hearing loss here and some hearing loss there and blah 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 blah." I said, "No, that doesn't make sense to me right now. If I got hearing loss, you need to let me know what kind of hearing loss I have. First of all, I need to know why I have my hearing loss." So I was on methotrexate at the time, and I was on hydrochloroquine at that same time. I have found out, I did my research, that both of those medicines can cause some ringing and noises in the ear.
Mhm.
wanted off of the medication.
Mm.
That was just me. I wanted totally off of that medication. Not only that, it had took my hair off. Because at that
Mm.
time I wore bald. So uh,
That's why I stopped taking it right away. My hair was
yes,
coming out.
yes. So he kept saying, "Well, what do you want from me?" I said, "Well, I want you to tell me or figure out why, I have this noise going on in my ear because I'm telling you, I hear noises in my ear. And I don't think it has to do with any hearing loss. I need to figure out what in the world was going on." Well, this doctor was going round robin with me. But like I said, I had my battle axes on. I was advocating for myself because I was not going to just sit there and let him try to talk me into getting some hearing aids because that's not what I came there for. He said, "Well, what do you want then? A brain scan?" I said, "Yes, thank you." So he ordered a brain scan. I got my brain scan and I never went back to him. I sent them test results
That's
I sent
fantastic.
the test results off to my Cleveland Clinic doctor after I got them done. And he scheduled an appointment with me, and I went back to Cleveland, and he explained my test results to me. Found out I had a bunch of white matter in my head. I still do. Yes,
Mm.
Is
I
that what they
still.
call that, the T2 flare or something? Like the white matter? I
I
did
had no
have an
idea.
MRI of
I
my
still
brain
have it.
recently.
I just had another scan just done here recently. I still have white matter in my head, in
Hmm.
my brain. Yes. But they said there doesn't seem to be sarcoid up there, but something going on up there.
Huh.
If What is the white matter anyway in your brain? What is that?
They didn't explain that to me either.
No,
And it did show also that, which I get migraines, it showed that as well.
I have migraines. And then to top it off, I have migraines, and then now I have another set of headaches on top of the migraines. Really? So something's going on up in my head. You know what I'm saying? Something's going on. But yeah,
So
I have neuro.
white lesions on the brain that appear on imaging tests like an MRI can be a sign of neurosarc, a systematic disease that causes the
Interesting.
formation of the granulomas. So there you go, ladies.
Interesting,
It's
because unrelated, I got um, injured at work, and they sent me, and then it's a whole big story. But anyway, I went to the neurologist, and they sent me, but they didn't explain what that meant.
Yeah,
Mm.
yeah.
so how can you
I
say
think I
that?
need to go see somebody else to look at that.
So how can you say white matter on the brain is not sarcoid? That doesn't make sense, does it?
No.
Huh, interesting.
Yeah. There's a lot that's interesting with this, and realize it is the snowflake disease. So we
Mm-hmm.
may be similar to one another at times, but we're not exact, unfortunately, because I think that would be easier to find a cure. I'm hoping COVID will do it. Yeah, so in neurosarcoidosis, white matter lesions are a common manifestation of the disease in the brain. Just reading what Dr. Google tells us. But again, remember it's Dr. Google or AI if you want. So
Yeah.
really, and
Hey, you taught me more than what happened is I went to go see somebody, and she goes, "Unfortunately, I'm leaving Stony Brook, so it's the first and last time you're going to be seeing me." And then when I went back, I went to see somebody else, and yeah, he didn't explain any of that.
yeah, Carol, you and I will talk. I have some doctors
Okay,
that are out here that are good. We already know we
thank
have the
you.
same rheumatologist, so and he's
Well,
good.
unfortunately, I don't have him anymore because my insurance wouldn't.
All
Uh,
right,
yeah,
right,
I had to
okay,
switch.
all right.
I'm on my
So,
third rheumatologist now.
all we'll talk and find some good doctors for you out here. Okay.
Thank you.
You're welcome. All right. It looks like we're the last six. So I'm going to say good night. And I hope to see everybody next November 13th.
Number 13th.
Good night,
Okay.
everybody.
Good
Thank you
night.
very
Thank
much,
you.
everybody. Nice meeting everybody.
Bye.
Thank you for sharing. Good night.
Anytime. Gail, I look forward to meeting you. Hold on. There she goes. I booted her out.
Oh,
How are you,
did
my
you
friend?
stop? Did you stop recording?
No, hold on.